Comprehensive, relevant, and insightful conversations about health and medicine happen here on MedStar Health DocTalk. Real conversations with physician experts from around the largest healthcare system in the Maryland, D.C. region. Lung cancer is the leading cause of cancer deaths in both men and women, resulting in more cancer deaths than breast, prostate, and colorectal cancers combined. It can take years to develop and is difficult to detect in early stages when there is greater potential for a cure. Fortunately, lung cancer survival rates are improving, thanks to advances in screening and treatment options, including breakthrough therapies that we're leading at MedStar Health in partnership with Georgetown Lombardi Comprehensive Cancer Center, a National Cancer Institute designated comprehensive cancer center. We can offer our patients promising clinical trials years before they become the standard of care. Our team of lung cancer doctors is composed of medical and radiation oncologists, as well as thoracic surgeons, interventional pulmonologists, lung pathologists, and radiologists, all of whom have dedicated training and experience in caring for patients with lung cancer. Working together, our team considers all treatment options to create a personalized care plan that involves the most advanced technologies and therapies to detect, diagnose, and treat your unique lung cancer. Welcome to MedStar Health DocTalk. I'm Ryan Miller. I'll be your host for today's episode. November is Lung Cancer Awareness Month, and today we're focusing on how to effectively diagnose, treat, and manage lung cancer. We are here with Dr. Edward Chan, the Chief of Thoracic Surgery at MedStar Washington Hospital Center. He sees patients at MedStar Washington Hospital Center and MedStar Georgetown University Hospital. Dr. Chan is double board certified and specializes in general thoracic surgery. He treats patients for lung cancer, esophageal cancer, benign esophageal diseases, and mediastinal tumors. Thank you for joining us on MedStar Health DocTalk.
Thanks for having me, Ryan. It's a real pleasure to be here.
Really excited to get a chance to sit down with you. As I mentioned in the lead, November is Lung Cancer Awareness Month. We'd like to start off by learning about your specialty. You are a thoracic surgeon. Can you explain what that is?
Sure, Ryan. Happy to do that. As you said, with November being Lung Cancer Awareness Month, it really puts a focus on our patients and how we diagnose and treat and take care of these patients collectively. My role as a thoracic surgeon is as part of a larger team here at MedStar Health that takes care of our lung cancer patients. The thoracic surgeon is a surgeon that takes care of diseases of the chest. So our training is in cardiothoracic surgery, and many of us further subspecialize into either cardiac or thoracic surgery. So as a thoracic surgeon, I deal with all diseases of the chest, including cancers like lung cancer and esophageal cancer, as you mentioned, and also non-cancerous diseases like acid reflux, hiatal hernias, achalasia, and other sorts of benign esophageal diseases.
Was there any family history or anything that prompted you to want to become a thoracic surgeon?
Fortunately, I didn't have any cancer or thoracic disease in my family. I think that the way that I decided to go into thoracic surgery was as a result of really great mentorship over the course of my medical training. I decided when I was in my fellowship in Seattle at the University of Washington to pursue thoracic surgery because of a number of reasons. One is that I got to be part of a multi-specialty team that took care of patients with really complicated cancer, and that kind of collaboration with other specialties was really appealing to me, as well as taking care of cancer patients. That kind of challenge and that kind of complexity was really stimulating. Also, as a thoracic surgeon, I get to do a wide variety of operations. Some of them are more complicated and take a long time. Some of them are more straightforward and are shorter cases. So it really adds a lot of variety to my day-to-day practice. And I think the last thing is that we get to work with really great technology as thoracic surgeons. We have all kinds of innovations. We have surgical robots. We have a lot of cutting-edge research and technology that we get to work with every day. So it makes the field really exciting and ever-changing.
It sounds like the more complex, the more you're game for the challenge of it.
Yeah, exactly. Yeah. So that really helps to keep me interested and engaged in the field, and also every patient offers a new set of challenges and a new set of circumstances that we really want to try to work with individually.
You had mentioned it briefly, but can you go in a little more detail on the variety of cancers that you see in your practice?
Sure. So far and away, we see lung cancer patients most frequently because, as you mentioned, lung cancer is such a huge problem. It affects so many people, and it causes by far the highest number of deaths from cancer of any disease. So lung cancer is the most common kind of cancer we treat. Esophageal cancer patients as well, we take care of routinely. And then other kinds of cancer in the chest, such as thymic cancers or thymomas, or other sorts of mediastinal cancers, are also very much part of the practice of a thoracic surgeon.
As we've discussed, this is a large problem, the lung cancer rates. Have they been spiking up? What is the trend that you've seen?
Yeah, it's definitely a major problem that we continue to see. We're diagnosing more and more patients with lung cancer every day, and overall the rates of lung cancer are rising. So it's a real problem that is not going away.
And what about the ages of these patients? Are they younger than you remember previously reading about?
We're definitely seeing patients earlier that get diagnosed with lung cancer. A lot of it's due to our increasing vigilance and utilization of lung cancer screening. So we're finding patients earlier and at younger ages, which is helping a lot in terms of their outcomes and being able to catch it when it's more treatable.
And you're there every step of the way during a patient's journey with lung cancer, from diagnosis to treatment and managing it. Can you walk us through what that looks like?
So thoracic surgeons are part of the multi-specialty team that's involved with each part of that process for the patient. As you said, from diagnosis to staging to treatment. So we can see patients very early on when they first discovered that they have a lung nodule. We work closely with our colleagues in pulmonology. A lot of times patients get referred to a pulmonologist first from their primary care doctor after a lung nodule has been discovered. Sometimes they come directly to thoracic surgeons. As we work through the process for these patients, we're involved with not only doing the necessary procedures and biopsies to get a diagnosis, but we're also part of the team that helps to do the procedures and tests to stage them and figure out how advanced their cancer may be. And then after we figured out the stage, that helps to inform how we treat these patients.
Thank you for walking us through that. What are some common lung cancer symptoms or signs that it's time to see a doctor?
Lung cancer can be a tricky disease because a lot of times patients don't have any symptoms at all. Historically, patients that come to the doctor with symptoms from their lung cancer already have fairly advanced disease, and there are fewer options for them to be treated. When patients come to the doctor with symptoms from their lung cancer, a lot of times it'll look like coughing up blood or having pain in their chest, but oftentimes at that point, their cancer is fairly advanced already. More frequently, thankfully, we're finding patients very early in their disease process before they have any symptoms. Thanks to lung cancer screening or just the increased utilization of imaging like CAT scans, we're finding really small lung nodules which have no symptoms at all. They don't cause any pain, they don't cause any cough, but they can be seen at a very early stage because of how accurate and precise our scans can be.
And the only way to catch it that early is to get screened?
We encourage patients who are high risk for lung cancer to get screened with an annual CT scan. But also because patients get scans so frequently these days, we're finding a lot of these lung nodules or early lung cancers because of some other sorts of scans that they're getting. They might get a scan for their back or for their shoulder and happen to see a lung nodule as a part of these scans, or even a scan for their heart, and they might find a lung nodule as part of those other scans.
So it sounds like a lung cancer screening is the way to go to detect lung cancer in an early stage. What's some of the criteria specific for someone to be eligible for a screening?
So to qualify for lung cancer screening, we have a few criteria that we try to make as simple as possible. The patient has to be between 50 and 80 years old. They have to be currently smoking or have quit smoking in the last 15 years. And then they have to have over 20 pack years of smoking history. So that means if they smoked 1 pack a day for 20 years, that would be a 20 pack year smoking history. Alternatively, if they smoked 2 packs a day for 10 years, that's also 20 pack years. So 20 pack years or greater puts them at high risk and would qualify them for lung cancer screening.
Thank you for breaking that down for us. In the last 10 years, vaping has grown in popularity. Is it too early to tell if vaping is leading to lung cancer?
Yeah, you're exactly right about that. We don't know yet if vaping is causing lung cancer. We certainly don't encourage people to vape because we really don't know what chemicals or toxins are in what they're vaping, and we don't know the long-term effects of that and whether it can cause cancer or other lung diseases.
If you're inhaling vapors into your lungs, that's probably not good for you.
Yeah, exactly. Yeah. We're discouraging that overall.
What about those who live in states where it is legal? Can marijuana smoke lead to lung cancer as well?
We also don't have enough data to say if smoking marijuana causes cancer. We don't have great evidence that it does, but again, I would say that pretty much smoking anything is not great for your lungs.
Good advice. Take note, kids, if you're listening in the car or wherever you may be listening. What about family history? If I've got a family history of lung cancer, does that mean I'm more susceptible to it?
Yeah, we're definitely looking hard at family history as a risk factor for lung cancer. It's not the strongest risk factor, whereas smoking is by far the biggest risk factor. But if you have any family members, especially first-degree family members, like your parents or siblings, that's definitely something to bring up with your doctor to consider as part of your risk profile.
Thanks again for walking us through what makes someone eligible for a screening. But if someone doesn't meet that criteria and still has concerns about their lung health, what would you recommend they do?
I think anyone that has concerns about their lung health should definitely talk to their doctor about it, whether it's their primary care doctor or their pulmonologist. I think there's many ways that you can have problems with your lungs. So finding your doctor and talking to them about your symptoms, your concerns is definitely the first right step.
Can you explain the different stages of lung cancer?
Sure. So we stage lung cancer on a scale of 1 to 4. So stage 1 being the earliest stage and stage 4 being the most advanced. So in stage 1 lung cancer, the cancer is limited to the lung tissue itself, and it hasn't spread anywhere else. Stages 2 and 3, the lung cancer has spread outside of the lung tissue to the lymph nodes. So the lymph nodes in your chest are the first places that lung cancer can spread to. And so if there's any spread outside of the lung tissue itself, it gets to be a higher stage, like stage 2 or 3. Stage 4 cancer means that it's spread outside of the lung to another part of your body. If we see metastatic disease to your brain or your liver or your adrenal gland or your bone, those are all markers for more advanced stage 4 lung cancer.
You don't want to have to catch it at that point, so that's why it's vital to get yourself screened.
Exactly right. Like I said before, too often patients come to the doctor after they've developed symptoms, and most frequently when they're advanced like that, when they have symptoms, that's a sign that they have more advanced cancer like stage 4.
If someone has been diagnosed with lung cancer, what are their next steps? How do you decide what's the best treatment option for someone who has it?
It's a complicated process to figure out the right treatment, but that's why it's so important to have a good team of doctors working with you. So this is where the multi-specialty nature of caring for lung cancer patients really comes into play. So after a diagnosis is made or after you found a lung nodule, that's where the staging process begins. It may involve more scans, like a PET scan or an MRI of the brain. It may involve some biopsies, like sampling the lymph nodes, all to check and see exactly how advanced the cancer is. Once we've figured out the stage of the cancer, that allows us to find and recommend the most evidence-based and effective treatment for the patient. And that could involve surgery with a thoracic surgeon. That could involve chemotherapy or immunotherapy with a medical oncologist. It could involve radiation with a radiation oncologist. So that's where the whole cancer team really comes together and decides how to recommend the patients move forward.
If someone gets past their lung cancer battle, is there any risk of it potentially reoccurring?
Yeah, that's a great question. Unfortunately, cancer does come back frequently, and that's why it's so important to really stay on top of it even after you're done with your treatment. So for all of our patients that get diagnosed and treated for lung cancer, we do surveillance scans afterwards to make sure that we keep a very close eye on whether the cancer comes back or not. The earlier the stage at which we catch the cancer, the more likely they can be cured completely. And so that really drives home the point of why it's so important to catch these cancers as early as possible.
Do you have any advice or recommendations on how we can protect ourselves from lung cancer? Not smoking, I'm guessing.
Yeah, exactly. So not smoking is really the best thing we can do. Other than that, there are certain chemicals and toxins that can also increase your risk for lung cancer. Trying to avoid exposure to toxic chemicals is important as well.
What does the future of lung cancer care look like? Are there clinical trials or new treatments available?
Yeah, this is a really exciting time to be taking care of patients with lung cancer because there are so many innovations and new developments in the treatment of lung cancer. From a medical oncology standpoint, there's a lot of new drugs and a lot of new therapies in the immunotherapy space that have done a lot of good for our patients. So there are constantly new trials coming out, new data coming out that shows really promising results for patients with lung cancer as it relates to immunotherapy. We also have other trials from the surgical standpoint that have come out recently that help us understand better how much surgery we have to do for patients. In the past, we had thought we needed to take more of the patient's lung out to have a full treatment of the patient's lung cancer. We used to take out the entire lobe of the lung to make sure that we got all the cancer out. And more recently, we've realized through trials and data that we can take out less of the lung tissue itself and still have the same results or even better results. So now, instead of taking out one entire lobe of a patient's lung, a lot of times we'll take something less than that, either just a small piece of the lobe or just a wedge or a segment of the lobe. So that way the patient can keep as much lung tissue as possible and breathe better after surgery.
Sounds like you're very optimistic about what the future of care in the space looks like.
Yeah, it's a really great time for people treating patients with lung cancer because we have so much new technology, we have so many innovations that are really helpful for these patients.
Are there any exercises someone can do to strengthen their lungs?
We generally recommend that if patients can do as much walking as possible, that's the best thing they can do for their lungs. Just to be physically active and getting out and moving their bodies is really the best exercise possible for their lungs.
Why should someone choose MedStar Health for their lung cancer treatment or care?
Well, in my experience, we have a really great team here at MedStar Health that collaborates very effectively in a multidisciplinary way to take care of our lung cancer patients. Between our colleagues in pulmonology, medical oncology, radiation oncology, we're really able to listen to our patients effectively and offer them the best cutting-edge treatment with a focus on taking care of them and offering them the best quality of life possible.
Well said. I just have a few more quick hitter questions about the screening, diagnosis, and treatment. So how often should someone get screened, and what does the screening process look like? Like, how much time out of their day does it take to get screened?
Yeah, lung cancer screening is really meant to be as simple as possible for our patients. So we recommend getting a CT scan every year if you're a high-risk patient. And it's really a pretty straightforward procedure where you come into the hospital, lay down on the CT scanner bed. The scan takes less than a minute to actually perform. So it's a pretty straightforward thing that it's not meant to be cumbersome. It's not too involved.
You can get in and out and on with your day. For those who have been diagnosed with lung cancer, what are some questions they should ask their doctor?
If you have a diagnosis of lung cancer, or even if you have a suspicious finding on your scan that might be lung cancer, the next step is to talk to your doctor about getting referred to a specialist. And that can be either a pulmonologist or a medical oncologist or a thoracic surgeon. We can all be a great access point and a great resource for lung cancer patients. I think one of our highest priorities is really overcoming the barriers to access that our patients have. So we want to make it as simple as possible for patients to be seen and for them to get plugged into our system where our multi-specialty team can take care of them in a collaborative way.
No matter what kind of specialist you might need to see, it sounds like we've got you covered within the MedStar Health system.
Yeah, absolutely. We all work really closely together. We meet regularly, whether it's in our tumor board or in other conferences where we're discussing the care of these patients collectively. So we can see patients with lung cancer or suspicious lung nodules and get them into our system very quickly and efficiently.
Lung cancer screenings are a relatively new offering. What are some barriers that you've seen regarding getting people to get screened?
Yeah, that's a really good point. Lung cancer screening has only recently been approved by Medicare and Medicaid and by private insurance. So only in the last few years have we really been using and encouraging lung cancer screening as much as we have been now. So if you look at other kinds of screening tests like colonoscopies or mammograms, about 70-80% of people who are eligible for those screening tests get those tests done. For lung cancer screening, unfortunately, only about 15% of people who are eligible get lung cancer screening. So it's something that we really need to get the word out about. So I think that we all recognize how difficult it is to quit smoking, and we're always thrilled to congratulate patients when they have cut down or quit their smoking because it's such a significant risk factor. There's a lot of social stigma around smoking, and that can be a major deterrent to patients going to get their lung cancer screening. So we really want to make sure that patients don't feel embarrassed or ashamed because of their smoking, and that they understand that we are here to take care of them and their health is our top priority.
Have you seen smoking rates decline?
Yeah, we're definitely seeing a drop in smoking overall, but it's still very common and it's still a very hard habit to kick, unfortunately.
For sure. You're a thoracic surgeon. What are some of the advancements in technology that make your job easier?
So this is one of the best parts of my job, is that we get to use really great toys at work every day. So in my practice, I use a surgical robot to do all of my lung surgeries. So as opposed to doing surgery the old-fashioned way, where we had to make a really big cut on the side of the patient's chest and cut through all the muscles and break ribs sometimes, robotic surgery allows us to offer patients really complicated surgery through a minimally invasive technique. We can make 4 incisions that are about half an inch in size between the patient's ribs and do a really complicated lung surgery through those small incisions. And that allows us to get patients home much faster. It allows us to have much less bleeding during the surgery. Patients have much better pain afterwards, and they get back to work in their normal lives a lot faster.
That's remarkable, and I bet they appreciate not having a giant scar across
absolutely.
their chest.
It makes a huge difference in their recovery.
Thanks again for all your time, Dr. Chan. I've really learned a lot during our discussion, and I hope the listeners will take your advice to heart.
Well, thanks, Ryan. It's been a real pleasure talking to you, and I really appreciate the opportunity to talk to you and to all of our patients about lung cancer and about thoracic surgery.
If you are a current or former smoker over the age of 50, a quick and painless low-dose CT scan could save your life. Low-dose CT scans give you important answers about your health. Visit medstarhealth.org/lunghra to take our free lung cancer quiz to see if you may be eligible for a lung cancer screening.